As OrthoNeuro's Director of Wound Care and Healing and a lower extremity specialist, I treat a lot of patients with diabetic foot wounds. It's going to be challenging to treat. For our diabetic foot wound patients, it's very important to intervene early, so early treatment is very important. I'd like to share a little analogy of the Bermuda Triangle and how that relates to a diabetic foot wound and getting better. We talk about the legend of the Bermuda Triangle. Things can get lost and never come out again. So we can get lost in this cycle of non-healing for patients that have a diabetic foot wound. So a triangle has 3 points. And if we look at that Bermuda Triangle and we relate that to healing, we certainly need to address these 3 points to get that diabetic foot wound better. So first and foremost, if we do nothing else but talk about getting pressure off of that diabetic foot wound, we're going to get some definite improvement. So a lot of times we say it's not what we put on that diabetic foot wound, but what we take off of it. So pressure relief, very important through shoe gear and activity modification, certain shoe inserts or specialized bracing. Even a total contact cast is utilized where the patient is casted and walking in this cast that takes all pressure off of that diabetic foot wound. Our second point is blood sugar control. Doesn't have to be perfect, but we like a hemoglobin A1C, which is a measure of blood sugar over a 3-month period, to be 8 or below. Okay? So that provides a favorable wound healing environment with respect to metabolism. So our third point to our triangle analogy here, our Bermuda Triangle of non-healing so we don't get lost in this cycle, is blood flow. Definitely arterial blood flow to that foot wound is very important to carry those nutrients to that wound, to nourish the wound to get better. So we have to think of these 3 things to avoid this cycle of non-healing with the diabetic foot wound and not get lost. Number 1, pressure relief, not what we put on the wound, but what we take off. Number 2, sugar control. And number 3, arterial flow.